Hello everyone, my name is Aisling Duffy. On behalf of the HSE Mental Health Engagement and Recovery team, I would like to welcome you to our inaugural virtual conference, Families Together for Mental Health. I also extend this welcome on behalf of our co-produced organising committee, made up of our NGO community partners, family members and supporters, and other sections of the HSE. As today is the UN International Day of Families, we decided to host our event to coincide with this. I will go through some housekeeping for the day now. As attendees, your name and picture will not appear on the screen. You can ask questions via the chat function on your screen. If you are using Twitter, please follow @recovery_R and please use the hashtag #WeAreFamily. The day will run from 10 a.m. to 3 p.m. and will include live panel discussion, pre-recorded videos and workshops. We will introduce each section as we come to it. Breaks will take place at 11:20 a.m. and 1:10 p.m. Before you go to your workshops at 11:40, we will talk you through this process. The morning sessions will consist of a live panel discussion on family recovery, which will start shortly. This will run from 10:15 a.m. to 11. If you're watching on Facebook Live and the website, we won't be able to take questions directly from these platforms, but please do tweet us. I would now like to introduce Michael Ryan, Head of Mental Health Engagement and Recovery. Thank you.
Morning. Thank you, Aisling, for the introduction. And I too would like to welcome everyone to our National Family Conference this morning. It is a great privilege once again to be here with you and to have this family conference this morning, which, as Aisling said, is to commemorate International Day of the Family. And I'm Head of Mental Health Engagement and Recovery. And just to tell you a little bit about the Office of Mental Health Engagement and Recovery, our aim is to lead and support the strategic and organisational development of mental health services which are responsive to the needs of people who access services, their supporters, and those delivering these services. And we do that in a number of ways. We try to incorporate lived and family experience into service improvement. We try to empower individuals and families to be leaders in their own recovery. We promote partnership between all stakeholders for better recovery outcomes. We continue to ensure recovery education is accessible to all. And we try to identify and promote best practice and innovation in recovery and engagement. And as Aisling said, today is about the family, and what we would like to do today is to celebrate, really, I suppose, celebrate and promote the role of family and supporters in recovery. And before I go on to talk a little bit more about that, there is one other thing we would like to celebrate today. As some of you may be aware, our colleague Francis passed away last weekend, and he was one of the main driving forces in organising this conference. So as well as celebrating the family, we'd like to celebrate Francis as a person today. His absolute professionalism, his commitment to service users and family members and to their right to recover, but most of all, his human qualities, his kindness, his integrity, and his overall calling card was his hope and his kind of eternal positivity. So we will miss you, Francis, but thank you for being part of our life. I remember when at one of our very early learning sets, when a family member shared, it's going back many years, and what they said really struck me. They said, When my loved one went into the mental health services, they were someone I knew, and when they came out, they were a stranger to me. And I suppose that really, I thought, was very unfortunate, because it seemed that the service was missing out on the great resource that family member was. Family members have huge knowledge in terms of supporting people in recovery. They understand triggers, they understand what works well, and that knowledge can be a great source of support to the person themselves, to services, and indeed to other family members. And that's what we try in mental health engagement and recovery, to access that resource and to make it available to others, including family members themselves. And today we're going to hear more about how we do that and to celebrate that. So I would just like to wish everyone well today, thank the team for putting it together. And I hope that you all really get a lot out of it, which I'm sure you will. So really, it's time to move into the conference itself now. So I am going to pass you over to my colleague, Michael Norton. Thank you.
Michael, for that introduction. Welcome everyone to today's conference, and I'm going to be emceeing the panel discussion that we will be having shortly. But before we go into the panel discussion, we're first going to have a little look of a video, and this video is about what is recovery in mental health. So without further ado, here's the video.
In Ireland, the Health Service Executive Mental Health Services vision is that recovery is a reality for all. So what does that actually mean? Well, anyone can experience mental health challenges. The good thing is people can and do recover. So how does a serious mental health challenge affect a person? Well, it may impact on their ability to carry out normal everyday tasks. It may be difficult to form or maintain relationships, find or hold down a job, make friends, and be part of the community. It can be a very lonely place, as they may have experiences that others just don't understand. So what is mental health recovery? First of all, it's personal. Recovery is as unique as you are. It's about living a good life with or without symptoms. It's about what you can do, not what you can't. It can be a journey for some and a destination for others. And it's not always easy, but with the right supports, recovery is real. Evidence suggests that recovery is best supported by 5 things. Just remember the word CHIME. C stands for connections, having good relationships with other people. H is for hope and the belief that you can recover. I is for identity, having a positive sense of yourself. M represents finding your own meaning and purpose in life. Finally, E is for empowerment, focusing on your strengths and having control over your life. That's CHIME.
So thanks for that video, guys. And now what we're going to do is go straight into our panel discussion. As I mentioned before the video, my name is Michael Norton. I am one of the National Engagement and Recovery Leads with the Office of Mental Health Engagement and Recovery, and I will be emceeing this panel discussion. I'm now just going to go through the panel for you, who they are and a little bit about them. So we're first going to start off with Cathy Mccabe. And Kerry is a principal social worker in adult mental health in North Dublin. She has substantial experience of working in partnership with individuals, families, and communities in relation to mental health. Kerry is interested in the concept of peer support as a means to support recovery, and as such has completed formal research in the area of peer support and families supporters in mental health, and family supporter assessments in mental health. Kerry leads a social work team which has a strong history of developing and offering recovery-focused services to families, supporters in mental health services. Next on our panel is Derek Pepper. And Derek is an interim national training awareness and support team leader with Shine. Shine is an organization that supports people with mental ill health. Derek is also the Regional Development Officer for the Northeast region with Shine, and has been in his role since 2007. Shine, as a national organisation, provides an extensive array of supports to people with self-experience of a mental health difficulty and their family members all across the country. Next on our panel is Sushil Teji. And Sushil is retired from corporate life and now volunteers his time to support work in the community with mental health engagement. He is currently involved in his local area forum and some national advisory groups representing the perspective of the family and supporters. Sushil is married with 2 children and engaged with mental health services as a spouse. He is motivated by the desire to keep the needs of the family members at the forefront of discussions and policy making around mental health in Ireland, and to ensure that those policies are matched with actions in the community. Next, we have Barbara Brennan. And Barbara is an inspirational thought leader in her field. She has over 12 years experience in changing the culture of mental health at all levels of society. A regular contributor to the national mainstream and social media, Barbara is at home speaking to local community groups, CEOs, or senior leaders in the public and corporate world. She has lectured in Dublin City University and Trinity College Dublin and University College Cork, inspiring people to think differently about mental health and well-being. In the national discourse on mental health, Barbara has motivated change and advised policymakers such as the National Office of Suicide Prevention, Irish Human Rights and Equality Commission, Mental Health Commission, and Irish Mental Health Lawyers Association. A highly esteemed trainer and facilitator, Barbara now uses her passion and experience to lead a national program, See Change, to give a voice to people with lived experience of mental health difficulties. Inspire a message of hope and recovery, and ultimately spark an international conversation on reducing stigma. Finally on our panel is Patricia O'Dowd. And Patricia is a mother of 4 adult children, all of which have been diagnosed with various mental illnesses. As a young adult, she cared for her brother, who also suffered mental ill health. She has seen a big change in how things are done from that time till now. Patricia's family are now a family in recovery, and as such, they feel a lot more positive. She states that it takes time to get to that place. Patricia now works on various initiatives in advancing family recovery and believes it is an essential part of the whole picture. So that's our panel. So what we're going to do is I'm going to start off with one question, and we would like to invite you as the audience to actually send in chat any questions you may have that you'd like to put towards the panel. So to start off, I'm going to ask Patricia, what does family recovery mean to you?
Family recovery means everything to me. When a family member has a mental health diagnosis or challenge, it has an impact on the whole family. Even though maybe in the beginning you don't realise that. For recovery to happen, we have to accept what has happened and acknowledge that we need to make changes and work at recovering. That takes time. And but we do need to undertake that work. Once you take that step, the first step, the journey starts. The ability to cope grows stronger. You start to feel more hopeful, which is really important, it being part of the chime. You start to feel that you don't need to worry all the time. You stop worrying about the things you cannot change. You realize that it's okay to enjoy things, and that doing so makes you stronger. It's part of being able to live your best life. You begin to realize that it's not your fault. That's a difficulty I had for many years, thinking that maybe I could have done something different, that it was my fault as a parent. But once you let that go, that gives you peace of mind. Recovery also helps you accept and see the illness as something separate from the person, and that you can engage with the person while not liking what the illness has done to them. It takes time, but once you take that first step, you're on your journey to recovery. And there are many steps on the road, and sometimes it's backwards, but once you've started, I think you're able to keep going. And I think there's a much bigger acknowledgement that the family recovery is a hugely important element in the whole system and for society as a whole.
Perfect. Thank you, Patricia. I would like to ask our next question to Kerry, if that's okay. And Kerry, I would like to ask you, how do you think services can support the family unit on their recovery journey?
Thanks, Michael. Can you hear me, just to check?
Yes, we can hear you, Kerry. We just can't see you.
Oh, you can see me now. Here we go.
Yeah.
Sorry, technology. Thanks for that question. I suppose there are lots of ways that we can try and support family units in terms of their journey on their recoveries. And I suppose for me, it's at many different levels. I suppose, first of all, for me, it's to actually think and remember that there is a unit, there is a family, there is a support circle around a person when they enter a service. So I suppose for me, very often it is at the one-to-one or the clinician level that we just remember that there are people around everyone that comes to attend our services, and that as well as supporting the person, the service user who attends the service in their journey, that we need to think about how we can scaffold and support the person by supporting their supporters. And that can be done in very many different ways. And I suppose it can be done by offering families their own support individually. It can be done by working with families as a unit. And I suppose it's important to remember when we talk about families, that can be anyone. It can be very many different types of people. Very often family units are a spouse, they're a partner, they're a sister, they're a brother, they're a grandparent, they're a parent, they're a child, they're a sibling, they're a friend. Or they may very often maybe formal supporters. People may live in just say supported accommodation and things like that, and may consider the people in that house or that service their family. And for me, that's all okay. That's important to remember and to consider. And I suppose it's also important to, I suppose, look at where people are in their journey. Very often when people enter the service, they're in crisis, they're confused, they're upset, they're unsure, and very often what they just need is people to say, it's okay, we hear you, we understand you, and we will do our best to support you in whatever way it is that you need for your particular family and unit. And I suppose part of that might be just introducing the concept of just talking and having a conversation with the wider family circle, having conversations that might be a little bit scary sometimes in terms of the confidentiality, that word that maybe frightens people sometimes. But I suppose just kind of opening up those conversations and saying things that maybe people feel afraid to say themselves. So being the person in the service, the clinician, taking that that leap for the family and opening up conversations for families. And I suppose further on then into people's journeys, remembering that we need to, I suppose, look at making our services, I suppose, responsive to the different types of family units that I'd mentioned. So, you know, we have in some areas of the country services that are tailored to children of people who have mental health difficulties, so children and their parents or their family units. We have interventions or supports that are for siblings of people who have mental health difficulties, and we have, I suppose, group-based supports that can, I suppose, offer families of any description a support or a space to talk to each other and meet each other, and get that sense of not being alone or not being in isolation, that other people are going through what they are going through. And then further on down somebody's journey, we have, and we're very lucky to have in lots of parts of the country, spaces where family members themselves are in a position to be supporters for newer family members that are coming into services. So I suppose in terms of looking at a family unit, I think from a service perspective, it is incredibly important to be responsive, to be flexible, and to simply ask the questions and not to be afraid to ask the questions, and not to be afraid of what we're going to hear, because generally if we ask the questions, we are generally able to respond simply by listening and simply by asking, how are you all doing and what can we do to support you, very often is enough. And knowing that for families, very often I have found, and this is just from my experience, families have found just being able to have a person's name and number that they can ring and check in with is very often all that they need, and we can do that. So I suppose for services, it's to be really clear that we support not only the service user or the person attending the service, but the wider unit that also is connected to that person, because we're only there, you know, 1 hour a week, 2 hours a week, you know, a number of times a week. We're not there 24/7. The supporters are the ones who are there 24/7. So it's important that we can do that for people.
Perfect. Thank you, Kerry. And I suppose what you really summed up there is the importance of, you know, that services as a whole see people, see the whole family as suffering at the same time as the person that's actually suffering from a mental health challenge. So that's really, really interesting that the services are starting to look at the whole family unit, not just the individual person. I would like to ask another question now to Derek. And before I ask this question to Derek, feel free for anyone that's attending here today to add in some questions, or if they have any questions they want to ask their panel, there's no problem at all. So Derek, just going to ask you, why is recovery for family members so important?
Good morning, everybody, and thanks very much, Michael, for giving us the opportunity to be here this morning as well. Recovery for family members, from the perspective of Shine as a national organisation, is something that's been very close to our heart for over 40 years now. And I suppose in the wider context, it's something that's become more prevalent over the course of the last few years, because people are becoming more and more aware of the importance of recovery for family members. We could say traditionally that when we speak about recovery, the emphasis tends to focus on the person with the illness, and rightly so, because recovery for a person with self-experience of a mental health difficulty is important. And it's important that a person is given the opportunity and encouraged to invest in the recovery. But it's vitally important that we also remember the impact that being a supporter and being a loved one has on the additional family members. When we look at the various different sacrifices, the things that family members have to do on a daily basis to try and support their loved one, they undoubtedly have a huge impact on the lives of family members. So all of those things need to be acknowledged. I know in the video that we had at the start this morning, there was a reference to Chime and the 5 different themes of recovery. And indeed, you could even sort of add to that. Anybody who's very familiar with the WRAP program, the Wellness Recovery Action Plan, will be familiar that there are 5 key concepts of recovery. Those 5 key concepts generally revolve around hope, education, support, self-advocacy, and personal responsibility. And whilst those things are extremely important to a person with lived experience of a mental health difficulty, they are equally important to family members as well. Because when we talk about recovery, we're talking about the ability to live the life that you want to live as an individual. Self-determination, being able to make your own decisions, being able to plot a path for yourself that you want to try, not necessarily influenced by somebody else. And whilst I said that's vitally important for a person with self-experience, it's also equally as important for family members. Family members have to understand that whilst they are supporting somebody, it doesn't mean that they have to sacrifice their lives in order to do that. Family members have to be able to follow the paths that they want to follow in life and live the lives that they want to enjoy as well. It's also important, I suppose, to note that when we talk about those paths of recovery, the paths of recovery aren't always parallel. They don't always go together in tandem. So a person with self-experience will have their own journey of recovery, but likewise, the individual family members who are supporting that person will have their individual journeys of recovery, and these also need to be respected. Will those journeys of recovery always go together in a parallel sort of tandem journey or direction? The answer is no. That will not always be the case. Sometimes they will, but not always. In some situations, we might see a person with self-experience who's enjoying a really good recovery, but perhaps the family members haven't really reached that point themselves yet. In a situation like that, you may have a person with self-experience who is eager to re-engage with employment and education and independent living. And perhaps the family members are resistant to that, maybe hesitant because of fear. Because I suppose when we talk about recovery, there is an element of risk involved. That risk, a lot of the time, is a very measured risk, but all the same, it's still a risk, so it is. For some family members, the thoughts of a loved one returning to employment or education can be quite daunting because there's that fear of relapse. And as Patricia mentioned when she was answering her question, that element of relapse is a part of recovery as well. It's how we learn, it's how a person with self-experience learns, but it's also how family members learn about what we need to do in order to be able to advance in our lives. So those of recovery, as I say, can be quite separate. And while one side might be doing very well in their recovery, it doesn't necessarily mean that the family members will also be doing well. So it's about acknowledging that and respecting that, making sure that family members in particular are encouraged, enabled and empowered to follow their journey of recovery. And as Kerry rightly highlighted, access to supports is vital. Now, it could have been said that, you know, in times gone by, family members felt very isolated and very alone, and perhaps there wasn't really an awful lot of support there for them. It's great to see that that is changing now, that family members are being brought more into focus when we talk about advancing the services, especially with Advancing Recovery in Ireland, the new initiative within the HSE, and we see the tremendous amount of family involvement in that. And other initiatives all around the country. If we look at Shine, for example, within our own organisation, the various different support groups, that we have developed, particularly for family members and their recovery in mind. And in particular, if we look to the Midwest, for example, we've the Friends Initiative, a fantastic initiative which has been developed very much with the recovery of family members at the forefront of everything that is done there. So we're starting to see tremendous advancements with regards to family recovery, because as it's been acknowledged already, recovery for family members is vitally important and it needs to stay on the agenda.
Thank you, Derek, for that. And I really take in what you're kind of saying about it. Self-care is even as important for the family member as it is for the person going through the mental health difficulty, and how if someone does go through a relapse in their recovery journey, it's not just the service user that learns, it's the whole family unit that learns a new way of understanding not only the family members, the person's recovery, but their own family unit in their recovery journey, learning about what actually helps them in that process as well. So thank you for that, Derek. So we're after getting some questions in, which is fantastic. Keep bringing them in as according as we go. I believe Gina has stated in the chat to all the attendees, if you just hover your cursor at the bottom of the screen, in the middle there is a chat button. In there is where you can type in your questions, where we can see them and fulfill the chat. And I'm going to bring up one of these questions now. And it says, and basically, what I'm thinking of is I'll bring in Sushil for this question, if that's okay. And Sushil, this is a question from Peter. And Peter asks, is there a bad time for family to be involved?
No, I would say that family should be involved literally from day one. And Peter, I mean, if I can just say from my own personal experience, you know, when you know, I suddenly found myself as a family member trying to confront a situation I just was not familiar with. I have to say at the time there was absolutely very little support around, but I am going back over 10 years, and I'm really pleased to say that since then a lot has changed. And even from some of the questions that are coming in, and people are asking, you know, not only do you get involved, but, you know, is there more supports out there? Is it sort of enshrined in law? Well, there is now actually a national framework for recovery, which is driving very much the policy towards supporting the family members. And that's very important, because that actually lays out the groundwork for all the services to look towards providing those services to families as well as the service users. I think from my own experience, I would say, you know, if I could talk to my younger self over 10 years ago, I would have said, go and find some help, because I tried to do it all on my own, and that's not always possible. So if I was to say one thing, ask for help, don't leave it too late. It's never too early. And always remember, there are a lot of people out there that are available and willing to support and help you. So yeah, go and ask for help is what I would always say. And also throughout the course of today, you'll see references to many support groups that are available. And also you'll find references to those support groups available online from the team here as well. So ask for help, don't leave it too late, and it's never too late to start. So hopefully that helps.
Thank you, Sushil, for that, and very enlightening words to kind of realize that, you know, it's never too late for the family to come in and support their loved ones through a mental health challenge. I'm going to bring up another question now from Jacinta this time. And Jacinta, I'm going to pass this question over to Kerry, if that's okay. So Kerry, Jacinta asks, how does a supporting family member go about accessing support from adult mental health services?
Sure. So in general, there are a few ways that people may enter mental health services. In general, I suppose the least upsetting or the easiest way is that people generally will attend their GP and their primary care services initially. And and people may not know this, but most mental health issues are actually supported and managed in a variety of ways at primary care level. So really, when people enter the mental health service, they have already gotten support or will have linked in. Generally, you know, the first point of contact is the GP, who can then direct people or signpost people and also support people themselves directly. So if somebody has gone through all of those channels and maybe has accessed community counselling or have attended support groups or supports they have accessed at primary care level, they still need maybe more, I suppose, intensive support, they will then be referred generally to the community mental health team by their GP. There are community mental health teams across the entire country. So any GP anywhere in the entire country, they will have a connection to one of their local mental health teams, and they will be able to facilitate that. And then the person is assessed by the community mental health team, and if they meet the criteria for entry into the service, they will then be assessed and be taken into the community mental health team, where in general, and this is a generalization, it's not that these teams are at full capacity, unfortunately, everywhere in the country, but in general, in the mental health team in the community, you should have access to a consultant psychiatrist. There will also be a junior doctor. There will be at least one, but generally more nursing personnel, so clinical nurse specialists, community mental health nurses. There will be social work support, there will be occupational therapy support, and there will be clinical psychology support. So that should be, at the very least, that should be what your core mental health team in the community is made up of. Some areas then have access to lots of other types of supports, such as peer support, such as addiction counsellors, family therapy, lots of different types of supports, which are unfortunately not uniform across the country, but your core team should absolutely be there. And once you enter the mental health service as a service user and as a family member, and this is important, and as a family member, you can absolutely ring your clinic and you can ask to be referred, or you can ask to see or talk to any one of those professionals. And that's as a family member as well. So in general, and it's just to kind of link into one of the other questions that came up, in general, if a family member wants their own support or wants to talk to somebody on a mental health team, if their loved one is already in the service, they can ring the clinic, the general mental health clinic number, and they can, in general, they will ask typically to see the social worker, to talk to the social worker on the team. That's the main, I suppose, professionals on the mental health team who might do a little bit more of the family work and services are generally the social work teams, but that's not uniform. Lots of every single mental health professional is trained to work with families, but typically the social workers will do the family work generally. But you can absolutely ring your clinic and ask to speak to somebody. Somebody will and should respond to you, but that's generally how people get into the service. And then when you're in, you have you should be able to talk to whomever you need, ideally.
Thank you, Kerry, for that. So I'd like to bring in Barbara now, if that's okay. And Barbara, what tips and tools do you and your family use to support family recovery?
There's a number of different things. I think going back to some of the things that have been spoken about already, this idea of asking, it's so important. And I think one of the things that we are so afraid of in all of these conversations is saying the wrong thing or not being heard. And I think there's a number of different levels there. So it's about finding the space and finding the way to speak to each other. And the other thing as well is to not assume. So when we're having those conversations, to be very aware that, you know, we don't know what the other person is thinking, or you know, what the impact of what we're going to say is. So sometimes starting off with the piece around, I'm afraid I'm going to say the wrong thing, or I'm afraid I'm going to upset you, or I don't know what the right way is, or I don't know where you're at the moment. So that piece around being really open and, you know, considering the language that we use. The other thing is, even in that space, sometimes this idea that we all learn in a different way, and our conversations can always be different as well. So it doesn't necessarily have to be a verbal conversation. So for example, at a time when I was very unwell and I wasn't able to communicate in that space, my mum and I used to write to each other. So we would write letters, and we would have a place where we would put them, and I would go and I would get hers, and it would give me time to consider it, to take it in, and to really think about my response. So that kind of piece is really important. As well, the other thing is that sometimes we jump into this giving advice piece, and I think that can be challenging in two ways. It can be challenging to the person who's listening to feel they have to give advice, and it can be challenging to the person accepting the advice, because maybe that wasn't what they were looking for, or maybe they're getting advice from lots of different people and it's confusing, or maybe it's just overwhelming. So again, sometimes checking in and seeing, is that a helpful thing? Is it something that they need? And particularly, again, going back to this family piece, that sometimes, you know, it's very relevant for the family member to tell the person how it's affecting them. Because certainly at times when I was unwell, I didn't realize the impact that it was having on my mum or my sister or my brother or my dad or whoever. And it was only at a time when we started going through family recovery that I started to hear their stories and their experience of my illness and what it was like, because very much it was always about me. It was about getting me well. It was about, you know, all focus was on me from the whole family. And so for it to be spun around and for me to see that they were struggling or they were in pain or they were exhausted or they didn't know what to do and they didn't have the answers, it changed how I saw things and it changed that interaction. So again, that piece around RAP that Derek mentioned, that was a huge part of our family recovery. So I did my own RAP and then I brought it to my family and we agreed on certain levels that we would interact on it. And we made lots of different conversations around those pieces, again, minding our language and saying, you know, how does this sound to you, or what would work for you? So I think trying different ways, asking, and really, you know, being mindful in that space, that also at a time when we are anxious, when we're feeling challenged, when we're feeling low, maybe we're feeling angry, maybe we're feeling not heard, sometimes we respond in a different way than we might otherwise. So to really try and come from a place of compassion, whether you're the listener or the speaker. And I think it's always important to bear that in mind, because these are not easy things to deal with. They can be quite challenging. And I think that's the thing, to really look at how we can do that. And the other thing that I found really helpful for my family as well, when I started getting better and I started looking at challenging stigma and helping other people, this idea of putting my story and my life out there, that was my choice. But it also meant that I was then putting my family in the spotlight to a degree and telling some of their stories. So again, we had to discuss the impact of what I did and what my life was on them and where they were at. So in the same way, you know, it's already been spoken about this level of recovery not always being the same. That very much definitely happened in our family, where different members of the family were at a different place at different times. But we had that discussion and we had that conversation. So I think conversation is key, but it's not always about sitting down and having a chat. You know, sometimes it might be, you know, talking to each other through messaging, or it might be talking to each other with an additional person there if conversations are challenging, because not everybody has a very strong family unit the way I do. I'm very lucky in that way. So it really is about finding how your family communicates and what is the easiest path to getting that kind of open communication so that you can do it together. And I think that's the biggest piece.
Thank you so much, Barbara, for that. And now what I'm going to do is go back to another audience member's question, and it's for Patricia this time. So Patricia, what has been the most significant changes over the years? Are we doing enough as a service, and what else could help?
Yeah, there has been significant change over the years. In our early days, when my daughter, she was only a teenager then, we were quite dismissed. It was kind of our fault. We weren't doing things right. Sorry. Hello, Michael, can you hear me now?
Yes, we can hear you now, Patricia.
All right, okay. I think there for a while I wasn't on. I don't know, did you hear me at all before this?
We did, we just couldn't see you.
Oh, well, that doesn't matter. I suppose to go back to say, more or less the question really is, what do I see has changed? In more recent years, I have found that the teams are much more interested in engaging with families, even though our family members are now adults. But they don't, our family members never minded their family being involved. So there wasn't any resistance in the family itself, which can happen in some cases where maybe where people are, because of their illness or whatever, their relationships have broken down. That wasn't our case. But I don't think for a long time that the services realised at all, and maybe we didn't ourselves, that when somebody is ill like that, that it has an impact on those around them, and that their own health and life is impacted, and that they need to learn ways of coping themselves. That's in my experience, that's only relatively modern. And like Sushil said earlier, if I had known years ago what I know now, I would have looked for more of that much earlier, and not carried that burden, where you feel it's your fault, it's your responsibility, what did you do wrong? So that you start on your own recovery. And even if your family member isn't at the same stage, it's still necessary for you to work on your own recovery. And that gives you more strength to cope with them, even if they're seriously unwell. So I do think things have changed a lot. I still believe there's a way to go. And I do believe it's a bit uneven probably in different places or with different teams. But we'll say my son, who's the most unwell member of our family at the current time, he works with a wonderful team, and they're very supportive of us as well as him. But the family does need to look after itself separately as well as with their family member. I think really that's all I could say on that. I do think we're going in the right direction. I think there still is a way to go, but at least we're marching in the right way. And I think the service is going with the families now, as opposed to not seeing that they had a very important role and a lot of knowledge about their loved one as well, to offer a lot of experience and a lot of knowledge.
Thank you so much for that, Patricia, and for your enlightening words. I'm now going to pass on to the next question to Cecile. So Cecile, a question has come in from our audience. What role does recovery education play in supporting families in their recovery?
Yeah, I think it's absolutely vital, because in many ways, like anything in life, you have to be given pointers, you have to be signposted, you have to be given answers as to, how your questions can be resolved as well. And this is where the recovery colleges are doing some fantastic work around the country. And it's important that people are given access to the courses. Now, of course, under the current situation, the courses can't be held, live in terms of meeting spaces, but I know a lot of work is currently underway to try and deliver some of those programs electronically in the way that we are doing here this morning, today, for the very first time. It's very groundbreaking, and it does mean it'll give access to a much bigger group. And through the work that's being done through those recovery colleges, you'll be able to at least get some ideas as to how your own personal situation can be improved. And more importantly, it also, many of those courses help you to also examine yourself and the way you have addressed things. And that's absolutely vital. As I said earlier on, I try to do it all myself, and which isn't the answer. You do need to reach out for help, look for those educational programs, look for the courses that are available, and find the one that best suits you in terms of your specific requirements, and lock into those. So the information is out there. Sometimes, to be fair, there is an overload of information, and I think that's where perhaps a little bit of time sifting through what is there, what's right for you, but also connect with someone in the services. I mean, we've heard from people like Kerry and Barbara and many others, and Derek, and the NGOs that are out there providing great support. So it's no longer the big minefield that it used to be. So reach out, find someone, link in with the local team, and get them to point you in the right direction as to what may be the right course or the right program to support you in your own recovery. And I think this, again, I just want to emphasize, today, with it being about families, is that families require recovery too. And recovery is not, and if I could just use that phrase, recovery is not a destination, it is a journey, and it's a constant travel. So find the right path for yourself, lock into the right services, because they are certainly out there. So hopefully that helps.
Thank you so much for that, Sushil. And I'm sure a lot of people are taking away so much from this discussion here this morning. I'm conscious that our time is starting to run out a small bit. So if we do not get to your questions, we will try and answer them the best way we can throughout the day. So I'd like to bring back in Derek, if that's okay. And Derek, I want to ask you, do family members follow a separate journey of recovery to their loved ones with self-experience?
Hello, Michael. Yes, that's very much the case. And I suppose I may have alluded to that at the very beginning when I asked the first question. And indeed, the other panelists have touched on this also. It's vitally important that the individual journeys of recovery are respected by everybody. Sometimes in life, I suppose we might look at somebody else and we might say, I wish they would do something else. I wish they would go in a slightly different direction. I wish they would look after themselves slightly better. But as I mentioned earlier on, at the very heart of recovery is that whole concept of self-determination, being able to live the life that I want to live. And in doing so, I have to be allowed to make mistakes. I have to be allowed to go down directions and perhaps have experiences that don't work out for me. Because as Patricia again highlighted at the very start of the morning, relapse is a part of recovery. There's tremendous learning in relapse. That's not to say that relapse is a pleasant experience. It's not. Relapse is not nice for the person with self-experience, and it's very, very difficult for family members to have to witness that and support somebody through it. But it is, in a lot of cases, an essential aspect of recovery. I know in my own experience of working very closely with people with self-experience, they will talk about their own journey of recovery, and they will talk about those times when their journey of recovery was going in a very different direction to their family members. Maybe the family were encouraging them to get back involved in employment and education and independent living, but that individual felt that that wasn't for them. Maybe perhaps they didn't want to engage with services at all and supports, and consequently found themselves relapsing at various different stages. But as those people have said to me, they've said, you know, my family members and my doctors could have screamed at me until they were blue in the face, telling me what I should do. But I had to find my own way in life. I had to make my own decisions. And I had to discover things for myself, what works for me and what doesn't work for me. So whilst we might like to try and influence other people's journeys of recovery, the fact of the matter is, what we really have to do is focus on our own individual journeys of recovery and make sure that that is where our primary focus is. Yes, we can still support somebody in their journey of recovery, be it going well or be it not. If somebody is beginning to relapse, we can still support them. But ultimately, have to find their own way along that journey. And whilst they're doing that, be it good or, as I said, if it's a case that things are deteriorating, as Patricia already highlighted, as relatives still have to focus on their own individual journey of recovery and ensure that they are living the life that they want to live. And as I highlighted earlier on, in a lot of cases, relatives, when I speak to them, will talk about that sense of having to hit the pause button on life. You know, maybe at one stage they had a social circle. You know, they went out on a Friday or a Saturday. They went for coffee on a Thursday. They had friends. You know, they were very actively involved in their employment. And then because they have a loved one with a mental health difficulty, they find that they have to hit the pause button on certain aspects of life like that. So they don't go out on a Friday or a Saturday anymore. Perhaps they haven't been able to avail of opportunities for promotion in employment. And eventually a relative has to look at all that and say, okay, I need to start re-engaging with these things. I start going back out and meeting my friends. I need to start living that life that I want to live. Because ultimately, if we don't do that, if our lives are so taken over and overcome by the whole situation of trying to support somebody, ultimately we become unwell as relatives. And unfortunately, that has been the experience for an awful lot of people, whereby the whole situation of trying to direct somebody else's recovery becomes very overwhelming for relatives, and consequently, they become unwell. So to a certain extent, we just have to appreciate and I suppose respect the fact that family members with self-experience and then the relatives who are supporting them will have very separate journeys of recovery, and each of us has to follow our own. And that particularly applies to relatives, as I said, who need to be encouraged, empowered and enabled to live the life that they want to live. And I suppose to enable them to do that, there has to be supports put in place. And it's great to see that now on a wider basis, that more and more supports are being put in place for family members. And again, from a Shine perspective, it's something that, you know, we've been very much at the forefront in providing for many, many years now, over 40 years, and we look forward to continuing that for many more years to come.
Thank you so much, Derek, and thanks for highlighting, even within the family's own recovery journey, that there are resources out there to help, such as Shine, that you've mentioned as well. I'm conscious we're running out of time, so this will be our last question. Any questions that may have come up on the chat, we will try and answer them the best we can throughout the day. And thank you all so much for actually feeding back so much to us. My last question is for Barbara, and I think it's a fitting last question for our discussion here today. So Barbara, I'd like to ask you, if you could give one tip on what can, for families to make things easier for them, what would you give?
So I'm going to cheat and say I'm not going to give one, I'm going to give two, because there's so many. I think the first thing, and it's already been touched on from some of the other speakers already, is this idea that each person is in their own journey. So I think that is really, really important, that each person in the family needs to recognize that it's not just the person going through the illness, but that they are also on this journey as well. So this idea that each person needs help and support in that space, and that's okay. And I think that can be a really challenging thing for people when they're looking after somebody who's in a really difficult space, to feel that, well, I need help too, and I need to be the important one. Quite often that isn't done. And certainly for years in my family, I was always put first and foremost, because that was what we did, and I deeply appreciate it, but I also see the impact on my family that I was put first. So that's my first piece, is to really look at individually, how can we mind ourselves? I mentioned compassion earlier, so that's part of that. How can I be compassionate to myself so that I can be of better support and so that I can understand more? The other piece as well, this has already been raised as well, this idea of asking. So I think it's really important to be, I think it was Sushil mentioned about looking for what's out there. I think for so many years, and to be fair, I'm going back a good 20 years now, we didn't know what the services were there. We didn't know what we could do. We didn't know about recovery. We didn't know about any of those things. And it was only as we went on, after years and years and years, and trying different things and being stuck and waiting for somebody to tell us what to do, and waiting for the doctor to fix me and all those things. Don't wait. Ask questions, ask people you know, ask people who are also in services, connect with, like the groups in Shine, the family sessions, they're so important. So ask questions and discover, what does family recovery mean to me personally? What does it mean for our family? And where can I get more information? And if I go somewhere and I don't get information that I feel is working for me or for my family, then I need to go again and ask somebody else. So just that thing of always asking. And also don't feel that you're on your own, whether it's that you feel that you're driving those questions for your whole family. Maybe the dynamic isn't there to ask within the family of what each person knows, but maybe to reach outside that and start asking. So there are so many different supports, and I know you're going to be sharing some of those later, but really to start connecting in and asking questions sooner. Because I think that was one of the things that I probably wouldn't have got as sick if we had had more information. So I think ask, be kind, be compassionate, and ask again. That's where I would go.
Thank you so much for that, Barbara. And I think a lot of people would take that away as well. And it's important, and I suppose we over time overlook it, but being compassionate to ourselves in our own journeys and making sure that we look after ourselves whilst we're supporting others is so important as well. So thank you so much for that, Barbara. That finalizes our panel discussion. I would like to thank our panel members, who are Kerry, Derek, Sushil, Barbara, and Patricia, for their open and honest communication with us here today. I hope you found it really, really informative. There is a ton of questions after coming into our Zoom webinar, and we will try and answer them over the course of the day. But just to introduce you to the next section of what we will be doing today, we're going to show 3 different videos with 3 different aspects of family recovery. The first one is looking at behavioral family therapy by Brian Donnelly. And basically, the description for it is that Brian explains how behavioral family therapy can support the whole family when there has been an initial experience of psychosis. We then go on to a video from one of our panel members, believe it or not, who is Patricia O'Dowd, who explains how she realized the recovery process was for all members of the family. Finally, we go to Alison O'Dowd, who will explain in her video about the positive experiences of working with the team for better outcomes for everyone. So I hope you really, really enjoy the videos. And once we are finished with the videos, we will come back to Barbara. Thank you so much, everyone.
Hi, my name is Brian Donnelly and I'm a HSE mental health social worker based in Dublin. Behavioural family therapy, or BFT, is a way of working with families where a family member has experienced a first episode of psychosis. And basically the aim of BFT is to improve the communication skills within the family, to enhance the family's ability to cope, and also to enhance the family's ability to problem solve. So the different aspects of BFT are, one is that it provides a way for family to receive more information around mental illness. Two, it allows the BFT worker like myself to develop a staying well plan with the family. Number three, communication skills such as active listening, expressing pleasant and unpleasant feelings. It helps the family to develop their communication skills. And four, it develops family members' ability to problem solve. BFT is an evidence-based approach, and the feedback that I've received from families has been very positive. Families have advised that they felt more involved in their loved ones' care planning, and they felt, as a consequence, more able to support their loved one in staying well into the future. And certainly as a BFT worker, I've been really, it's been really enjoyable for me to provide BFT to families, to see the positive engagement with families around BFT, and also to be involved in training new BFT workers to continue to support families in the that attend the HSE mental health services.
Hi, my name is Patricia and I'm a mother of a family where there's mental health diagnosis. In the early days, I thought that what was required was that the family member who was ill get the help they need and that everything would be fine. But I soon realised that it does have an impact on everybody in the family and on different people in different ways. Nowadays, there is much more acknowledgement of that, and that can only be a good thing, both for the family and the member who's unwell. They need to do their own recovering, and the family have a lot to offer to the staff looking after the person who's unwell. There's a wealth of knowledge there, and being able to use this is empowering for them and helpful for the staff. Recovery is possible, and the family itself needs to recover as well as the person who is ill. It is a process, it is fraught with difficulty, it has its ups and downs, but once the process starts, people become more hopeful and more empowered, and with that knowledge they can recover, and while the family won't be the same in the future, it can be at least as good, if not better, than it was before. Thank you.
Hi, my name is Alison and I'm a peer support worker with my own lived experience, but today I'd like to talk about family, or more specifically family recovery, because family recovery is possible. I have a brother with a diagnosis of severe and enduring mental illness, which can impact an entire family, and in our case had a devastating impact. I used to worry all the time about the impact of the situation on my older parents, their physical health, their mental health. I used to worry about how I would cope after they died, what would happen to my brother, how would I deal with it, how would I take care of him essentially. And most of all, I carried around a deep sadness because I knew he was going through the most agonising pain and I was powerless to help. Things are very different now. Ever since his care was taken over by the rehab and recovery team in Sligo, better times became possible. For the very first time, a team got to know my brother. They listened to my parents because they realised the fantastic resource that families and supporters are in the recovery of their loved ones. My brother has made fantastic progress with much hard work, but it's been done with the support of professionals. And when teams engage with those people, those supporters, carers, family members, it leads to the best all-around care. For me, it's led to great peace of mind because I know, even when my brother has symptoms or setbacks, that he's getting the care he needs, and that's reassuring for me. Our whole family have begun to heal, and I'm just so happy to have recovery, not only for myself, but for my brother too, and for my family. And like I said, family recovery is possible, and every family deserves that. Thank you.
I really hope you enjoyed those 3 videos from Brian, Alison and Patricia, and if you have any questions at all, please do get in touch with us. I would now like to introduce Barbara Brennan. Barbara was on our panel previously. Barbara is the Programme Coordinator of Sea Change, Ireland's national organisation dedicated to ending the stigma that surrounds mental health. You're very welcome again, Barbara.
How are you doing, Aisling? Thank you so much for having me on today, and I think it's wonderful that we're having a conversation about family and what family recovery means. So I suppose I'll start a little bit just by talking about Sea Change, because for some people they may not have heard about Sea Change. So Sea Change is a project of Shine. So as you know, Shine is supporting people affected by mental ill health, and Shine realised that there was an issue separate to helping people to discover what their journeys were and discover what recovery was. They realised that there was a whole separate issue just around stigma. So Sea Change was born with this idea that stigma needs to be reduced and people need to understand what stigma is. So I started working with Shine through Sea Change 10 years ago at the launch of Sea Change, telling my story about lived experience and about recovery, because it was something that I certainly never knew. I never knew that I could get better. I never knew it was a possibility. I never knew that I could be medication free, that I could get a job. Some of the things that we've been talking about this morning about what happens when, in that video that we've just seen, what happens when a parent dies, who's going to look after that person? I'm sure that my family had very difficult times thinking about what would happen to me at times that I was incredibly well. So when I suddenly found wellness in my life and I found myself off medication because the wellness things I was doing were working, and I started living a really good and healthy life, I started realizing that somebody should do something, because people are still really struggling with severe and enduring mental illness. People are still struggling supporting their families, and conversations were not happening. So still, we're going back 10 years, to be fair, and I know things have changed, but there is still so much that needs to be done. So by the end of 2009, I had survived suicide the year before, and in that year found incredible wellness, and I started realizing that that was something that I could build on and improve. And I started realizing that I never knew that was an option and that somebody should share that. And then I realized that I was somebody and I could help. And so when I joined Sea Change, my participation in that was as a volunteer, to share my story and be part of this message that people can and do recover, but also that everybody has mental health. And I think that was something that was really new. And it still is for so many people, that people don't understand that mental health is something that we all have all of the time. And one of the things that I do to help people understand that is ask them the question if they've ever been happy, if they've ever been sad, if they've ever been really pissed off about something, if they've ever been heartbroken, if they've ever been so joyous that they are just on top of the world, if they've ever been worried enough that they've lost sleep or that they haven't been able to focus on something. That's our mental health. And I think when we can understand it in that concept, it does 2 different things. First of all, we start to understand that it's not this alien thing. It's not totally different and totally separate. It gives us the empathy to start understanding, well, I know when I'm really worried, that pit of the feeling stomach and that anxiety that I get, I know what that's like. So maybe I don't know what severe and enduring illness is, or I don't have that experience, but maybe I can connect to it from a point of, I've had heartbreak, I've had sadness, I've had this anxiety on regular levels. So I can understand a little bit. So it's about how do we have those discussions, and Sea Change is really about how do we help people start that conversation. And what stigma is really is that piece where people feel that they are separate, that they are worse than, and that they are seen as they're going to be stuck in that place forever. So this idea that, you know, you are less than, you are worse than, and that's never going to change. It's wrong. It's totally wrong. And it's one of the things that we say, you know, if I am a daughter, an artist, a friend, a sister, all of those things, I also happen to have a severe and enduring mental illness. I'm very grateful to be well and healthy now, but that diagnosis is still part of my life. The question that I ask people is, if we are having a conversation and I get up and I leave the room and I come back, am I the same person within those few minutes? Most of the time people will say to me, yeah, of course you are. Then I say to them, well, what if I just got off the phone and I've just been given a diagnosis of a severe and enduring mental illness? Have I changed now? People want to say no, but quite often you can see them kind of going, not sure. And it's this idea that we need to have these conversations. We need to be talking about what it is that gets us to that point that we see somebody being different or being less than or less capable, or that we can't have a conversation. And quite often the things that I've seen in the last 10 years is that people drop all conversation. So we say that stigma is silence. So it isn't about necessarily being actively mean. It isn't about necessarily actively discriminating against somebody. Sometimes the way stigma shows up is that we hear silence. And what that looks like is the normal conversations about what was on TV, about what the kids were doing, about work, about shopping, about all these normal things. All of those conversations disappear as well. And that's where the biggest problem is. Because if you can imagine that somebody is in a difficult place and they're struggling with a mental health issue, we've got that. That's a barrier. And then we've got this stigma thing on top of that. So that piece is making people feel like I cannot seek help. And we also have a thing that we call self-stigma. So that's where the person who is struggling perceives that they are going to be stigmatized. They're going to be treated differently and less than. So they then turn around and stigmatize themselves. So an example of that would be, let's say I feel, well, I'm going to be treated differently if I go into work or if I go to a shop or I go to wherever. People are going to ignore me. They're not going to speak to me. They're going to look at me differently. So maybe I just won't go out. Maybe I should just keep myself separate. And then we see isolation happening. We see people pulling back and going more internal. That's the kind of thing that we also need to address by discussing this piece around stigma, because really mental health difficulties are challenging enough without this barrier where people cannot reach out and have a conversation. And really what we want to do at Sea Change is make it okay for people to have a conversation about mental health, but also to know that they don't need to be experts. Because this is the thing, quite often people who have a conversation about mental health, they quite often haven't been trained in that. And this is the thing that has been such a huge difference in my life and in the lives of the people in my world, shall we say. Because of my journey, I've made it okay for people to talk about mental health, even though they haven't had experiences or even though they haven't been trained. And this is the thing, that quite often some of that silence comes from fear. So for example, at a time when I would have been very unwell, people were afraid to talk to me, not because they wanted to say something mean to me, but maybe because they were so afraid they were going to upset me. Maybe they were afraid that they were going to make me ill again and that I was going to get worse because of something they were going to say. So it was easier to say nothing. And in that silence, I then would perceive all of the different things, and I would then make myself worse because of what I was perceiving and the loneliness I was feeling. Those are the kind of things that we need to challenge. So the ways that Sea Change works is we do lots of different things. For example, you've probably seen a green ribbon. So this year, obviously with COVID-19, we have postponed our green ribbon campaign until later in the year. So there is a warehouse with 500,000 of these. So they will be coming later in the year. But in the meantime, we have downloadable resources. So you can get the like of our stigma booklet. This is downloadable from our website. We also have a number of resources there as well, and that's seechange.ie, S-E-E change.ie. We also have lots of interaction online with ambassadors. And what an ambassador is for Sea Change is somebody with lived experience sharing their story, talking about what helps them, what doesn't help them, what works, what doesn't work. And I think those are the kind of things, that's how we make change. And certainly for me, being in a position where I lived 15 years of severe and enduring mental illness, I was never going to get better. I was never going to work. I was never going to be off medication. And yet here I am, 12 years later, off medication, living an incredible life. I own my own house. I've run my own business. I now run our National Stigma Reduction Program with wellness. It's not without its challenge, and I do work through that, but being able to have those conversations, and on days where things are not great. So for example, let's take COVID, for example, perfect. This is the perfect time to be having conversations. And when we're talking about family, now is the time to really be looking at, if we're in a family dynamic that isn't particularly healthy or isn't easy, how do we change that a little bit? Or what other supports do I put in place? If it's a thing that I'm not used to talking to my family and we're all together, how do I change that dynamic and start to be able to have conversations? What I'm not saying is that you have to get into a big, deep conversation and dump it all, but sometimes just being able to say, you know, I don't feel great, or I'm not in the best mood. Or maybe sometimes admitting to somebody, you know what, I'm not in the best mood and I could do with your support. I could do with a bit of company. We do have that challenge at the moment where maybe the company is just a video call. But if we don't reach out, and I am totally guilty of this, and recently I had something happen and I didn't have a great day and I didn't reach out. And when my family found out that I hadn't been great and I hadn't reached out, they kind of went, well, what was that about? How, you know, we're not telepathic. How were we supposed to know? And I think that's the piece that we were talking about earlier. Ask, 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 ask. So firstly, ask yourself, what do I need? What would help right now? Secondly, ask for help. And thirdly, the person that you're checking in with, you need to be asking as well, what would help from a point of view of, if I'm asking them for help, I need to have some idea of what I'm asking. So it is all of those pieces that we need to be looking at. How do we have those conversations? I think also we need to be really aware of that link to family recovery and that piece around, you know, if I'm struggling, there's a chance that maybe they are too. And particularly with COVID at the moment, I think people are starting to get better about understanding the topic of mental health, because so many more people are struggling with anxiety, or starting to feel depression, or they're starting to feel all these different things that they wouldn't have felt before. And it is giving us a unique opportunity to really reach for these conversations and say, let's go and do this together. And I think that is one of the bravest things that my family have done over the years, is to not be afraid of those conversations and to say to me, I don't know what to say to you. I haven't a clue, or I'm afraid I'm going to say the wrong thing. And I think this goes back to language, and it's one of the real things that Sea Change looks at, educating people about the language that we use. So for example, at the moment, I'm hearing an awful lot of people talking about crazy times, or how mad it is, or how mental it is. And I think that is partly because we don't understand the impact that that has on people, but we also don't look at the difference of language that we use. So for example, when somebody says to me, God, I've had a mental day. First of all, that feels very uncontrollable. It feels anxiety inducing. There's all those pieces around that. So when I say to somebody, so for example, how do I challenge that? The easiest thing is to say, well, that's really interesting language that you've used. So how would you change that? Then we look at, what are the things that we could do right now? So for example, let's say that piece about what you've just said, what about if I said it's a challenging day? So now all of a sudden I feel like I have a little bit of control on that. And I'm also now going, challenge, that's something I can rise to. It's something that maybe I can reach, or maybe I can't, and maybe I can get support in that. Whereas when we're using that kind of stigmatizing language, we're doing lots of different things in it. So I think there is an awful lot that we can do, but really bringing it back to what we're talking about here today, about family recovery, and about those kind of conversations. We need to look at the very, very basic of what we do first. How do I start a conversation? What would help me? And also knowing that some conversations, maybe you need to pick the right time. Maybe you need to go to somebody and say, I need to have a chat, and you know, I'm a little bit uncomfortable about it. Can we put some time aside, rather than just going in and landing it on somebody, because maybe it's not the right time for them. So that thing about asking again and discovering, there is so much that you can do, but also again, going back to that kindness and compassion, making sure that if you're going to have that kind of difficult conversation, that you do something nice afterwards, and that you realize that maybe it's the first time that that family member has had that interaction from you, or vice versa. So there is an awful lot that we can do, and from a point of view of Sea Change, we're here to help to start conversations, certainly. And again, then we would be signposting towards support if somebody was looking for additional supports, and we would always link to the Like of Shine and the family groups that they run there. So again, going back to everything that we've already talked about, ask again, be compassionate, be kind, have a conversation, and certainly join us later in the year. Green Ribbon is coming, so we would love to see you online. You can reach us on Instagram, Twitter, Facebook, and also on our website at seachange.ie. So thank you so much for your time, and thank you for having me today.
Thank you so much, Barbara. Your insight and level of expertise and knowledge around personal recovery and family recovery is just amazing. I really do hope that all our attendees here today have got something from your conversation there. So we're now going to have a 10-minute break. You can stretch your legs or make a cuppa, and we will see you back here at 11:30. So just a 10-minute break, and hope to see you all back here at 11:30. Thank you. Back, everyone. I hope you got time to stretch your legs and maybe even get some fresh air on your break. We're now going to look at some videos that relate to eating disorders and family involvement in a loved one's care, and maybe learning more about this. So I'm going to introduce two videos. The first is Harriet. Harriet Parson works with Bodywise. She's going to speak about the Pilar Program, a family program for eating disorders. Harriet describes how this information, education and support program, Pilar, promotes recovery for families affected by eating disorders. We will then look at Dr. Michelle Clifford. Michelle is a consultant psychiatrist, and she speaks about family-based therapy, a family program for eating disorders. Dr. Clifford outlines supports for families where eating disorders have developed in younger family members. So hope you enjoy these two.
Hello, today I'm going to tell you a little bit about the Bodywise Family Support Programme called the Pilar Program, based on the idea of peer-led resilience. In 2014, we were reviewing our support services, and we thought that in our family and friends support group, that really family had lots of questions. They always came with questions, and they wanted more than just the support space. So we put together a 4-week structured family program where we would provide families, and that's mums, dads, sisters, brothers, boyfriends, girlfriends, husbands, aunties, grannies, any member of the family can come, where we would provide them with information, psychoeducation, knowledge, and ways of thinking about how you can understand an eating disorder so that it's helpful if you're supporting a person who has an eating disorder. The way it works is families come together for one evening a week for 4 weeks. And in that way, over the 4 weeks, we get to know the families who are in the room. And by the 3rd or 4th week, we know everybody's situations. And we also then can provide them with a space where they can ask questions that are specific to their situation, and where they can get and give the support that the support group would normally give. We cover lots of different themes during each week, as well as allowing time for questions. Themes such as understanding eating disorders, thinking about an eating disorder as a coping mechanism, how to have a conversation and communication skills and how to listen, Other things, we drill down into how do you understand how a person with an eating disorder interprets their world, and that can help families reframe the negatives that they're experiencing as positives, and it can help change the family dynamics and make the family situation easier and less stressful. We talk about managing meal times and establishing a food and eating routine. We talk about dealing with anger and arguments. We talk about recovery, what the recovery process is like for a person with an eating disorder, and we talk about treatment. How do you know when treatment is working, and how do you know when treatment might not be working, or when there are questions that need to be asked? So we cover an awful lot in the 4 weeks with families. The Pilar program is absolutely free to attend, and people just need to book a place, and all materials are provided.
My name is Dr. Michelle Clifford, and I'm a consultant child and adolescent psychiatrist, and I work in a specialist community eating disorder service within the HSC for young people and children up to the age of 18. I'm delighted to be able to talk to you today about how important families are in the recovery of a young person experiencing an eating disorder. Eating disorders are significant mental health conditions, the most serious being anorexia nervosa, as it has the highest mortality rate of all psychiatric disorders. Anorexia nervosa typically has its onset during the teenage years, when young people are living at home with their families. Traditionally, one of the causes of anorexia nervosa was thought to be family dysfunction, and this of course can lead to high levels of blame and guilt for parents. What we now know, and what the research has shown over the past 20 years, is what was previously described as family dysfunction is in fact a family accommodation. It describes how a family adjusts to and responds to the situation of having a child who is seriously unwell with an illness such as an eating disorder. Families are in fact the best resource to support their child recovering from an eating disorder, and this is the fundamental principle that underlines eating disorder focused family therapy for anorexia nervosa. It is also called the Maudsley method, or family-based treatment, FBT. It works by empowering parents to take charge and take care of their child during the refeeding process and to restore them to physical health. It helps parents interrupt eating disorder behaviours and improve communication around food and meal times. It also aims to restore sibling relationships and eventually to help the young person get back to normal adolescent development. Eating disorder focused family therapy also directly addresses any blame and guilt parents may feel in order to alleviate it. It's a treatment that is, it's a treatment that's not of the family, but it's a treatment that's with the family. Eating disorder focused family therapy for anorexia nervosa is now the first line recommended treatment and can achieve really good recovery and response rates, especially with early onset of illness. And there's also emerging evidence that can be helpful for other eating disorders such as bulimia nervosa and ARFID, which is avoidant restrictive food intake disorder. If you'd like further information on eating disorder focused family therapy and indeed on eating disorders in general, there's lots of information available on the HSE's self-care app for eating disorders, and this can be downloaded for free on the HSE website under the National Clinical Program for Eating Disorders. Thank you.
Hi, my name is Becky, and today I just wanted to talk to you a little bit about family and the recovery process. When a family member is diagnosed with a mental health condition, it can often have the greatest impact, not only on the person who's diagnosed, but also on the family members who are there to support their loved one. One way in which I got the help and support that I needed is that I connected with others out there in the community. I joined support groups and I went to visit a counsellor myself. And I also reached out and got the support I needed for joining the Recovery College, where I learned all the different mental health difficulties, and I was able to identify with my loved one in my family's condition, and I was able to offer them support, but whilst also getting the vital support that I needed in order to help myself and allow my family to go through their own journey. By reaching out with others and connecting, I was able to really help myself. I understood the different diagnoses that are out there, but I also was able to give myself the support that I actually needed, and I was able to distance myself whilst focusing on myself, and I was able to be there for the person that needed the help and support by knowing how to help them. Thank you for listening.
So we just heard there from Becky. Becky Minahan is involved with Mayo Recovery College, and Becky was outlining how she got support and how that support helped her whole family with recovery. So thank you very much to our three speakers there. So we're now going to move into the next part of the morning, which is your workshops. So I suppose I just have some information and maybe to get you to your workshops now. So if you registered for today's conference via Eventbrite, you would have received an email link yesterday. In that email, there were 2 links. Please now use the second link that you received, and this would bring you to your workshop. So it brings you away from the Zoom webinar and to your Zoom workshop. So we will see you back here at 1:10, and please do enjoy your chosen workshop. So if you haven't registered via Eventbrite, we will now share the links in the chat function. There are 7, so please choose one of the 7 to attend and head to that link. I will stay on the chat function here if anyone is having difficulties clicking the links, and I will share them with you. So please do go as soon as possible to your workshop, and we will see you back here at 1:10 for guided meditation. Everyone, you're very welcome back from your workshops. I would like to now introduce Grace McGee. Grace is from Family Resources Centre National Forum, and Grace is going to do some guided meditation with us. It's so important to look after our bodies and our minds and to be mindful and connected to both and reflect while doing this. So thank you very much to Grace, and she's going to do some meditation until 1:30 with us. Thanks, Grace.
Thank you, Aisling. So just a little bit of housekeeping first. So if you could just make sure that you're sitting comfortably, ideally on a chair so your feet can be resting on the floor for the practice. If that's not possible for you, that's okay. Also, maybe check that your phone or your laptop is supported so you can concentrate on relaxing for the next 20 minutes. If you wish, you may put your phone on silent. I also have music on in the background, and again, you can adjust that yourself if you would like to lower it. So today we are going to do a meditation practice. We're going to start with breathing exercises to help to ground us. We're then going to move into a body scan. We're going to bring in some loving kindness and finish up with a thought for the day. So for now, I invite you to feel your feet on the floor, feel your breath, and just be. If you wish, you can close your eyes if you're comfortable doing so. If they are open, maybe pick a point that you can softly focus your gaze on. So it's whatever works best for you. So we will start by visualizing, smelling the flower and blowing out the candle. This breathing technique helps to ground us and it helps us to focus on our breath. So we're going to do this 3 times together. So smell the flower and blow out the candle. Smell the flower and blow out the candle. Smell the flower and blow out the candle. Another breathing technique is I am breathing in, I am breathing out. Again, we're going to do this 3 times together. So I am breathing in, I am breathing out. I am breathing in, I am breathing out. One more time. I am breathing in, I am breathing out. So sitting comfortably with your spine straight, yet at ease, and your feet flat on the floor, your hands resting on your lap or by your side. Become aware of your breath as it enters and leaves your body. Notice your breath as you breathe in through your nose and out through your mouth. Notice where your breath is. Is it high in your chest or is it down in your stomach? There's no need to change it or judge it. Just simply notice it. As you sit here, just become aware of the sounds inside the room. Maybe a clock ticking. Maybe your heart beating. And now notice the sounds outside the room. Maybe a car passing by. Or maybe people talking. Whatever it is that you notice, just let the sounds come and go. If you find your mind wandering, don't worry about it. Just gently notice your breath again. The inflow and the outflow. The rise and fall of your breath. Take a moment to notice how your body is feeling in this moment. Physically, you may notice tightness, tiredness. Maybe you have little energy, or maybe you have lots of energy. Just notice how it is, and if there is anything that you may want to release and let go. Our thoughts may be busy. So take a moment to notice your mind and release any thoughts or feelings you want to let go. We are going to rest and let the breath settle. Really let the breath out on your out breath. There's no right or wrong way to do this. The rest of the time, we're going to rest and go into each body part. So this will be the body scan to see how each part is. So starting with the head, I invite you to bring your attention to the crown of your head. Your forehead, the side of your face, your eyes, your eyelids, your nose, your mouth, your jaw. Just take a moment to notice the jaw. A lot of the time we hold tension here. We will move on to bring attention to the back of the head, down the neck, right across the shoulders. Again, just take a moment to notice the shoulders, as a lot of the time we also hold tension here. We'll bring attention down the arms, your wrists, and your fingertips. Observe as much as possible without judgment. If you find your mind wandering, don't worry about it. Just gently notice your breath again. The inflow and the outflow. The rise and fall of your breath. Let your body relax. Let's explore a little bit further. Can you feel your heart? Your stomach? Right down your spine into your lower back. Your left leg. Your right leg. Your left knee. Your right knee. Your left foot. Your right foot. Now taking a few slow, long, deep breaths, and on each out breath, feeling yourself relaxing into the chair and allowing all tension to drain away down your arms and legs and out of your body. Allow yourself to rest and restore your body. Enjoy some quiet time. Being really aware of the breath as you breathe in and as you breathe out. If you notice any thoughts coming, just let them pass you by, like passing clouds, and come back to the breath. Again, there's no right or wrong way to do this. I'm going to read you some loving kindness. May I be filled with warmth and loving kindness. May I be happy. May I be well. May I be safe. May I be healthy. May I be kind to myself in this moment. May I be filled with warmth and kindness. Once you are ready, let yourself get in touch with your breath, the inflow and the outflow, the rise and the fall of your chest. Feel the breath coming in, whizzing around your lungs and going out. Once again, just notice how you feel now as you bring your attention to your head, the sides of your head, your face, your jaw, your neck, your shoulders, your arms, down your back, your feet, the whole of your body. Just notice the sounds, both inside and outside of the room. Again, just notice them and let them go as you breathe in and out. As we come to the end of this practice, take a full, deep breath in and exhale fully. And when you are ready, if you had your eyes closed, you can open them and you can return your attention to the present moment. I hope that that has brought you some sense of relaxation. And I just would like to finish with a thought for the day. If you light a lamp for somebody, it will also brighten your path. I really hope you all enjoyed the meditation session. So thank you, everybody, and I hope you enjoy the rest of the conference. And I'll pass you back to Aisling. Thank you.
Thank you so much, Grace. That was lovely and a great reminder to us all to be mindful and more mindful, and perhaps just take a spot in the day where we can sit and practice that. So we are now going to go into some family conversation chat rooms. These will give you an opportunity to speak to experts of family recovery in a smaller group format. You can ask specific questions, perhaps some of those questions that came up earlier for the panel may be answered. You can discuss the concepts of family recovery and receive information and signposting and advice on how you can get involved. Please now return to your workshop room using the link you were given for your earlier workshop. I will also share this in the chat function, and we will see you back here in the Zoom webinar room at 2 p.m. for the final hour of our virtual conversation. So if you just use the link from your earlier workshop, that will bring you to your family conversation chat room. Thank you, everyone. Welcome back, everyone. I really hope you enjoyed the family chat rooms and the conversations that were brought up, and really hope they were beneficial to you. We are now moving into the final hour of our conversation on this conference this afternoon. The next two videos are about family programs, and these family programs can support the whole family around parental mental health difficulties. The first video is by Mary Kelleher. Mary is a HSE mental health social worker, and the topic is Thumbjam. Thumbjam is a family program which supports families to talk to their children about parental mental health difficulties. We will then see Mary G. Killeen, and Mary G speaks about how Family Talk supports parents and encourages children to be part of family recovery. So we really do hope you enjoy these.
Hi, I'm Mary Kelleher. I work on the mental health social work team in HSE North Dublin Mental Health Service. The social work team in my area are developing a brand new, exciting model for working with families where one parent attends our service and has a serious mental health difficulty. The model that we're developing is called Thumbjam, and it's a workshop model with the aim of helping parents to tell their own story of their mental health in their own words to their children. Thumbjam is part of a nationwide HSE and Maynooth University study with the aim of developing best practice guidelines in this area. There's increasing international evidence for a whole family approach to supporting families in terms of their mental health. We also know that children in families where one parent has a mental health difficulty are at increased risk of negative outcomes in many areas of their lives. Thumbjam Workshops will run for a series of 2-day workshops, drawing on narrative therapy, drama therapy, art therapy, principles of family therapy, therapeutic group work, and also drawing on the findings of my own PhD research in family communication. The first workshop was due to run in March. Unfortunately, it's now on hold until we can get families together again. We're currently looking at developing an online module which we can use in conjunction with the workshops. If you'd like some more information about Thumbjam, you can contact me, Mary Kelleher, at the North Dublin Mental Health Social Work Team, St. Francis Centre, Station Road, Raheny. Thanks for listening.
Hello everyone, happy Families Day. My name is Mary G. Killian. I'm a principal social worker working in adult mental health services in the west of Ireland, in the Galway-Roscommon area. I'm going to talk to you about Family Talk today. Family Talk is an intervention that we offer to families where a parent has mental illness. And it's an opportunity to bring the whole family together to have a conversation about the illness and what their understanding of it is. So we would start with the parent who has the illness and talk to them about the diagnosis, what they understand about it, what their experience of treatment has been and the service has been, and what's worked for them and what hasn't. And then where there's a spouse involved, we would include them with the parent's consent. And, you know, very often nobody's ever spoken to them or explained the illness to them or heard what their understanding of it is or what they notice about their loved one. And then with the parents' permission, we would meet with the children and ask them what they understand about the illness or what they notice about mom or dad, depending on which parent it is, what they're like when they're unwell. And we know from experience and we know from research that children do worry about the parent, do worry about, say, if the parent becomes more withdrawn, wants to be on their own more, or more anxious, or begins to worry more about what people are thinking. The children notice this and they worry about it. And if we don't explain to them what's going on, they kind of make up their own mind about it. And very often they think it's something to do with what they're doing. They're not doing enough chores at home, they're not helping out, or they're not doing well enough at school. And they worry about these things. So this is why Family Talk is helpful. It helps us to have a conversation about that. And then we talk to the family about things they could do to strengthen their mental health, things they could do to look after it, like doing more relaxation, doing more fun things together as a family, or looking after their diet, their exercise, having more activities outside the home, and everybody doing something nice for themselves as well. So Family Talk, professionals around the country are trained in it. Not everybody is, but I'd encourage you to go into your service and ask, is there anybody here trained in Family Talk? And could my family have it? And so ask your doctor, nurse, social worker, occupational therapist, psychologist, whoever you're working with on the team, ask them about Family Talk. And we want it to be available around the country, but it will take a bit of time. But the feedback we've got from families is that they do find it very helpful and are delighted to get it. So thank you very much. Enjoy the rest of today.
So I hope there was something there for everyone to learn about and maybe look for more information on. So our next 3 videos look at a range of topics. We first see Maria McGoldrick. Maria is a family member, and Maria describes how she realised recovery was also possible for her as a sibling. We then see Mary Kelleher, and Mary has already spoken in a previous video, and this video will be about family connections and a family connection group which encourages recovery within the family. Our last video in this segment is from Cathy Mccabe, and Cathy is also a HSE mental health social worker. Cathy outlines how the Family and Friends Skills and Support Group promotes family recovery.
Recovery was a very alien concept to me when mental health illness entered our door over 30 years ago. It was something that I thought was not relevant to me as a sibling, but more important for the person I was supporting. However, it wasn't until several years later, when I heard somebody share their story of mental health illness, that it really hit home to me that I had indeed been quite negatively impacted on in my life as a result of mental health illness in my family. That person, unbeknownst to them, gave me hope. They had the same diagnosis as my family member, and they lived a fulfilling and meaningful life. With that hope, I realised that my sister and I could recover from this trauma of mental health illness in my life, in our lives. So from there, reaching out to others, expressing my experiences, and telling people what it was like for me was the first step in recovery. The most important thing I discovered is the more I talked and the more I met people involved in mental health, the more I realised that we all are impacted when mental health illness enters our family's home. So for me today, the most important advice I can give you is to reach out to somebody and remember there is always hope. Thank you.
Hi, my name is Mary Kelleher. I'm a mental health social worker with the HSE North Dublin Mental Health Service. I want to tell you about Family Connections. Family Connections is a group programme for family members and supporters of people with emotional dysregulation and self-harm. Family Connections is based on dialectical behaviour therapy, or DBT, and the programme for families was developed by Dr. Alan Frusetti, who works with Marsha Linehan on her DBT team in the States. The programme is sponsored by the HSE, and in our sessions we use videos that were developed by the HSE Mental Health Service in Cork, and these videos are available for anyone to use on hse.ie. The programme we've been running in North Dublin has been running for 3 years now. It's an evening group, usually about 10 to 12 family members and supporters. The groups are a mixture of skills teaching. We use videos, some group exercises, and a lot of chat and sharing of learning between family members. Outcome studies for Family Connections show that family members' empathy for their loved one can increase after attending Family Connections, and also that family members find DBT skills really useful skills for managing their own mental health and self-care. If you would like more information about Family Connections, put Family Connections into the search box on hse.ie and you will find more information about the programme and also the links to the videos. Thank you.
Hi, my name is Cathy Mccabe and I'm a social worker in the Dublin North Mental Health Service. I coordinate the Family and Friends Skills and Support Group. It's an 8-week psychoeducation and support group developed using an evidence-based model. By looking at the national framework in mental health and the family recovery guidance document, we are focused on the implementation of the core actions within this document, which resulted in the development of the Family and Friends Skills and Support Group. The group offers both practical and process-orientated support. The group covers issues such as who's who in the mental health service, communication skills, boundaries, self-care, recovery, mindfulness and relaxation. The group is for family, supporters, friends and loved ones of those who attend the Dublin North Mental Health Service. We take referrals on an ongoing basis and referrals can be made by any member of the MDT or we take self-referrals as well. The group has been running for approximately 3 years and is facilitated by 2 social workers. We found that running the group in the evenings increases programme attendees. The group runs for approximately 2 hours and the development of the programme was first run by or first developed by the Social Work Department. The focus was to enhance peer support for families while offering information and empowering families in their situations. Subsequent developments of the programme have formally included feedback and recommendations from programme attendees. Positive reported outcomes from the attendees include getting information, not feeling alone, and having a place to talk with people who understand their situation.
Wanted to let you know again that you can still ask questions through the chat or make comments, and we'll endeavour to get back to them after the conference ends over the next couple of days and weeks, because there's a huge amount of conversation being generated today. And as a reminder that if you are on Twitter or social media, that to follow us on recovery_IRE and to look up the hashtags We Are Family. Today is International Day of the Family, so there is a lot of content online to browse and to look at, so please do take a look. So we're going to continue into the next part of our afternoon and look at some more videos. So our next video explores trauma-informed care. Jennifer Ha is from Alcohol Action Ireland, and the topic of this video is what is trauma-informed care? Jennifer explains the value of having services that understand and respond to those impacted by traumatic experiences. We'll then hear from Gina Delaney and Colin MacDonald about the role of family members. Gina and Colin describe how family recovery is an ongoing process and involves the whole family. So we really do hope you enjoy these.
Good afternoon, everyone. My name is Jennifer Haw and I'm Policy and Research Officer with Alcohol Action Ireland. And I'm here today to give you a brief overview of the concept of trauma and the need for trauma-informed mental health services. Many of you here today will already instinctively know that unresolved trauma is at the root of many mental health and indeed addiction problems. And the science and research clearly tells us this. That's why it's really so important that mental health services and indeed all public services really move towards the understanding of the underlying trauma that brings people to their doors. For family members too, there's trauma, vicarious or second-hand trauma, because for certain the trauma of the person, of course, impacts on the whole family. And this is very much in line, these principles of trauma-informed care are very much in line with the recovery approach, which champions responding to people in a respectful way, giving people choice, listening and looking for strengths rather than pointing out weaknesses. So what can we do to move towards trauma-informed care services? Two basic things are required. We need a commitment from government that our mental health services and indeed all of our public services become trauma-informed. And the other thing is that this really comes from, as well as being pushed from the top down, that it comes from the bottom up, and that workers on the ground understand trauma and not necessarily be an expert in trauma, but to recognise it, identify it and be able to respond appropriately. This could be really as simple as, instead of calling a patient challenging or violent, it's recognised that they're in distress, they're traumatised. So in a practical sense, for services on the ground, being trauma-informed means integrating understanding of past and current traumatic experiences into how your service operates. Professionals must be trained and family and community must be utilised in recovery. Environments must not re-traumatise and people must feel safe and in control. And for families, which is what we're talking about today, trauma-informed care means that services adopt a way of working with service users and their families that's empowering and promotes self-determination and fosters personal choice. So while we're all wondering what our new world will look like post-COVID, really we need more than ever is what we need in our services, kindness and empathy. And we need to ask people what has happened to you rather than what's wrong with you. And we really need to keep this really simple but absent concept. We need it to be pushed from the top down as well as nurtured from the bottom up. Thank you.
Hi, I'm Colin.
Hi, I'm Gina.
And this is about family recovery.
Yeah.
And what it means in the process.
Yeah, yeah.
So, well, for us, like, I suppose you have to finding yourself is the first, well, one of the first things you can do, like, you know, because a lot of people, you know, get affected in different ways, like, and, you know, recovery for them is, you know, finding themselves.
Yeah, and when you feel like that, you know, that you've kind of done some work around finding yourself, then you can do some work about finding each other and coming together so that you can work together better.
Yeah, and you can achieve all this through getting support and helping. You know, there's loads of ways and loads of groups and agencies and all out there that, you know, helps, and doctors and psychiatrists, and, you know. So, you know, don't be afraid, like, there's plenty of places you can go to get help.
Yeah, and when you get support then, and when you feel more supported, then you can start looking forward to the future together and start planning for the future and seeing that there is a future together.
Yeah, you know, and you can work through all the difficulties and that, you know, that everybody faces in everyday life as well, like, you know.
Yeah, all of us go through difficult times, whether it's as individuals, as couples, or as families. We go through difficult times, and when we work through those difficult times, then you can look forward to the good times together, and you can see the good times and focus on the good times more.
Yeah, and you know, it's a process. Family recovery is a process, and it's an ongoing process, you know, and it involves everyone in the family.
Yeah, so like when families go through difficulties and challenges, it affects everybody in different ways. And when you feel like you've, you know, that you're happy with yourself, then, you know, that you can be happier as a family together. And that involves everybody, and it has an impact on everybody, and everybody feels better as a result of it. So, like, for us, for example, we have kids, and it's important that we're happy and, you know, feeling good in ourselves and with each other, so that our kids feel the benefit of it then as well. So for us, as I said, family recovery is a process, and it's an ongoing process, and it involves everybody in the family.
So we hope this can help, and thanks for listening.
Thank you.
Thank you.
Take care. Bye.
Hi there, happy Families Day, and we hope we share our seeds of wisdom from lived experience with you today. And I'm going to pass you over to Charles, who is going to talk to you about, Rory, about connectedness.
Thanks very much, Maria. My name is Rory, and I guess I come from service user background, and it's a lovely privilege to talk about connectedness and mental health, and especially mental health recovery, because it hasn't always been that easy to feel connected or to be connected due to the very nature of mental health. I think that by its nature, it kind of makes people isolated. It can force you away from the people that you love, that you care about. And that bridge is something that I've learned. It may be broken, but it's not burnt. And there's a great piece of mental health recovery that happened in my own story that kind of brought me back to the people that cared for me, brought me back to the people that were always there, but I wasn't able to be a part of it. You know, celebrating Family Day today gives you time to reflect, and it gives you time to reflect on how we're connected. And all the years that I was away from my family, I was still very much connected to them. Being a part of family doesn't go away. You don't disqualify yourself from it. And I think that's just so important to know when you're in the depth of it, whether you're a service user or a family member, just to know that family is family. And there are very hard times, there are very, very difficult times. And sometimes I put expectations on things and I want them to be the way that I imagine them to be. And that doesn't always work. So now when I reflect on how I'm connected with my family, it doesn't have to be perfect. It's done in an unconditional way and in a way that I love. And so thank you very much for that.
Thanks, Rory.
Charles?
Hi, I've been asked to talk a little bit about hope. And we keep on hearing and repeating the mantra that hope is at the heart of recovery. And from my own experience, hopelessness is a kind of state of unease that's entangled in rumination on my darkest parts and questioning the worth of my existence. It's kind of a living hell. But hey, I'm still here. And one acronym from hope is hold on, pain ends. And it does. And as families, and by that I mean any group that shares a fridge, and thank you, Rory, we have shared ambition and interlinked identity, and a set of working assumptions for each other and also about each other. And these get devastated by mental health crisis. And then we need to go through a process of mourning. And from my own experience, the person in crisis is correlated with the family system in crisis. And this doesn't imply causality or worse, blame. We all take a hit together. And I believe that the importance of personal recovery for each family member is not nearly recognised enough by ourselves and by our society. And our culture and our healthcare systems aren't set up for a family system response. And only our shared understanding and identification of this kind of gap can lead to a saner approach to our own mental health. In a crisis, relationships are redefined. The provision of care and life support the crisis demands can play havoc on our sense of place in a family. And we also have to deal with external stigma and the internal strain of fresh family roles, secrets and stories. And I don't list these things to dramatise. Our family needs to be vaguely aware of them in the moment, and they need to be attended to when the fog of crisis clears. And for me and for each of my 4 children, the most debilitating of these shockwaves was our own guilt and shame over the feelings of hopelessness and rage that we each experienced of what happened to us. In the moments, we didn't have the perspective or the resource to understand that these feelings, and to reassure each other that our intense negative emotions and sense of hopelessness were a natural, almost healthy response to the extraordinary circumstances we found ourselves in. Our collective wisdom was slowly garnered through a number of time to think family listening meetings, and these were an amazing resource. And yes, in practice they were weird. And pain ends, and this too will pass. And so the seeds of wisdom I'd like to pass on hope are that hope for identity and ambition can be held by others until we can hold them for ourselves. And that the unconditional high regard of others is the ground on which I rebuild my own sense of hope. And this exercise of seeking wisdom through our experience of trauma and difficulties has not perfected anyone in our family, but it has changed and deepened our appreciation of each other. And with that, I'll pass over to Paul to examine identity.
Thanks very much, Charles. So, you don't need me to tell you that we are not connected in the traditional manner that we're used to. And I believe that in these trying times, having a sense of self or identity is going to be what could really help to sustain us moving forward. So that big question, who am I? It's kind of 3 words, but it's very hard to answer that sometimes. And it takes some work. I know in my early years growing up, in my family, I would have, I suppose, identified as a victim. And it took me a while to get through that. It took me moving away from home over to the United States and exploring different things. So, I became an employee, became a boyfriend, and I eventually became a husband and a father. So I was wearing lots of different hats. And all of this came together to sum up who I am as Paul. And that helped me to move forward through my own mental health issues and it helped me to be a better person myself. And it's very easy to lose sight of that in our everyday busy lifestyle that we find ourselves in. But one thing I feel that this crisis has given us is time to think and time to react. And I know myself, working from home as I do, it's a shock to the system. And I found myself trying to question, well, what am I going to do with this time? How am I going to, work this out? Because I'm so used to being around people. I'm part of a running club and I can't, get to run with my buddies, and I don't get to see my family in Galway. So I started doing different things. I started listening to music, which has always been very important to me, and to the words of the songs. And they helped me to remember what it is that makes me feel good about myself. And I started doing my runs in smaller circles and seeing different people, and people were waving at you and smiling at you, and that helped sustain me. And I really think that moving forward, to take that time for ourselves. We all have our own identity. We might be part of a family unit, but if you know who you are yourself, what empowers you as a person, that can help whole family as a unit, and it can help us all through this crisis and to move forward on to the next step. So just I'd like to say thanks very much. I'm going to pass you over to Maria.
Thanks very much, Paul, and thank you very much for the opportunity to talk to you today about the process of recovery called meaning. And I suppose I was particularly delighted to be given the importance of meaning from a sibling's perspective, because I feel when mental health illness entered our family's door nearly 30 years ago, as a sibling, my sense of meaning disappeared. 1 minute I was a happy-go-lucky teenager, and 2 seconds later I didn't know who I was anymore. I didn't know what was going on. I had no sense of meaning. I had no role. I was once a sister, and then all of a sudden I found myself in this quasi-professional supportive role where I tried to be as helpful as I could, help with medications, help with this, help with appointments. What can I do to help? And in a way, I felt it was important that I just slipped into the background and let the family, and more importantly, my family member that was experiencing such distress, be the center of focus. So after a few years of that, I lost my own sense of meaning. I lost my way, so to speak, and I was very much forgotten about. So I'm honoured to be able to talk to you today about the siblings' perspective. And what helped me along my journey, it took me quite a while to realise actually that I was impacted by what was going on in my home. To help me along, I had to re-establish myself, my identity, my meaning, and most importantly, hold hope for my family member that they too can recover. So thank you, and I'd like to pass you over to Patrick, who's speaking about empowerment.
Thanks for that, Maria. So today I just want to speak to you a little bit about empowerment, and I just want to tell you kind of the role that empowerment has played in my life and how my thoughts on it have changed. For whatever reason, when I heard the word empowerment, I always thought of, kind of one person empowering another person. And I always tended to view it more of a transfer of power rather than something that comes from within a person. The truth is that empowerment is also a process of becoming stronger within yourself and more confident and controlling your life and claiming your rights. And I suppose even with that little shift, it changes the way that I viewed empowerment. Empowerment can come from within me as opposed to someone else giving me power. And I suppose one thing that's really helped me over the years develop my sense of empowerment was bringing awareness and intention into my life. And the way I did that was through mindfulness. And you don't have to be an expert or even have a great interest in mindfulness to practice bringing awareness into your everyday life. In my case, it was just a vehicle to bring awareness and insight and attention just into the present moment. And when I look at the situation currently with COVID, when the restrictions kicked in, my well-being was, like many people, was impacted. And I felt a real loss of power in many areas of my life. And the benefit mindfulness and paying attention brought for me was that I started to notice the amount and the type of food I was eating, how sedentary I was becoming, the unhealthy amounts of social media and news, and the lack of social connectivity. And I suppose prior to that, prior to really noticing that, this was something I was sometimes doing subconsciously, or I was falling down a rabbit hole, kind of on social media, or without even realizing, promising to call a friend instead of just sending them silly memes, all of that type of stuff. So what practicing mindfulness allowed me to do was just to recognize how these activities were making me feel, and consciously then start to make changes by paying attention to the things I knew would give me something back. Some of the things that would improve my well-being and give me a sense and control and power back. And I'm kind of reminded of the diagram with the 3 circles contained within each other. In the large one, you have all your concerns. And then the second largest one has the things that you can influence. And then the third, or the inner one, has the things you can control. And I suppose I learned that the more I focused on the things I could control, then I found out the more I could influence, and the less taxing those things outside my control became. So the bit of lived wisdom that has been particularly relevant for me in recent times, not to mention kind of many times in the past, is that I can empower myself by my actions, by what I pay attention to, and by what I prioritize. And reflection and mindfulness were just the vehicles for me to put the brakes on for a minute, take stock, and bring my attention to the present. So thanks for your time, and I'll pass you over to Rory.
You're on mute.
Thanks very much, Patrick. There you have it. A wonderful take, I guess, on the recovery tool that is Chime. So you got some words on connectedness, some words on hope and identity, meaning and empowerment, and that's theoretical, but the nuts and bolts of it is Charles spoke about the family being a system. He spoke about the fact that pain ends, and he spoke about that we can recover together, and that's very powerful stuff. Paul talks about identifying as a person, figuring out who I am. That's a big thing to do. It's very hard to do it on your own, but it can be done. And I think that when Maria talks about losing her way, that there's an awful lot to be had in that. I think we all have to lose our way. That is something that we always put upon the service user, and we never think of family members as that can happen to them as well. But you come around then to Patrick's final words there, and when we do things with intention, when we meet the world and we can take time to check in with ourselves and see how we feel about something, we're far more connected, we're far more empowered. And you know what? It took 5 of us to do this video. And we're not family, but I'd be glad to share my fridge with any of them. And that's what family is as well. So from that point of view, thank you very, very much for this opportunity. Bye-bye.
Oh, that's brilliant.
So I just want to thank all of those involved in making that video about Chime. So maybe some of you never heard of Chime before today, so it's something to really to learn more about and to use in our daily practice, and even just thinking of our own lives and maybe the lives of our family. So I just want to say thank you to the area leads of mental health engagement for putting that together. So that's Maria McGoldrick, Rory Doody, Charles Searson, Paul Fallon, Patrick, and I suppose the overall description of that video was to use Chime. So to use connectedness, hope, identity, meaning and empowerment through our own experiences, insights and knowledge. So we're just going to reflect a little bit on the day so far, and we had a huge number of questions into the panel. So one of the questions we're just going to answer at this point. So the question is, What advice would you have for working with an individual whose recovery goals may be different from the family's recovery goals? So our panel of experts have come back with some great pointers for this. So first of all, this is so common. Talk about it. Find a way to talk together openly, perhaps through an MDT meeting or with a family therapist or relationship counsellor, for example. Other ways are family work, which is really helpful. We heard BFT be mentioned earlier. And it's okay to have different goals, but to recognise each other's needs. We need to recognise that everyone in the family has valid views and that no one is right or wrong, and it's all done out of love. To remember, I suppose we'll just move on from that question, and just one thing we really want you to take from today is keep talking about family recovery. Connect with your local recovery colleges, your local forums. Have a look online for all the different supports that are available, and really we want people to get involved in recovery, education and family recovery. And something that I really took from the last video from the area leads is that family is often a group of friends or people that may not be related to us. So family has many different meanings for many different people, and to keep that in our minds as well. So our next video and our final video in relation to family recovery today is going to be by a panel of experts by experience and profession. They're all from the Southeast area, and they explore CHIME again. So connection, hope, identity, meaning and empowerment. And I'd like to thank Belinda, Gina, Louise, Sean and Sharon for producing this video for us.
Happy International Families Day, everyone. And in this video, we're going to talk about the importance of using CHIME in family and how to support families. We have a panel of experts, of professionals and experts by experience. And I'm going to pass you over to Gina.
Thanks, Belinda. Hi, my name is Gina Donnelly and I'm a Development Officer at Mental Health Ireland and facilitator with the Recovery College South East. And I'm going to talk about the C in CHIME, the connections. For me, what helped us in our family with family recovery was connecting with my peers, so connecting with other family members who were going through difficult experiences and taking part in a support group. I found that very helpful. Also connecting in with other supports that were available, such as with family therapy. So that just helped us to connect with each other in a safe, supported environment to work through any difficulties. Also connecting then with each other in our family and as a wider family with, the wider family and friends in our community, and, just building on, I suppose, happy times together, fun times together, and building good memories for us as a family. So that's what helped us with connections in our family recovery process. I'm going to hand you over to Louise now.
Okay, thanks Gina. Hi there everybody, my name is Louise Burke and I am a mental health nurse, and I've been working in this area for quite a number of years, and I've been working with lots of people both individually and both within their family unit. So today I'm going to talk about briefly about the H in CHIME. So the H means hope and optimism. I really believe that recovery is possible for all with the right supports, and that people can lead a full and fulfilling life, and they get to live beyond their diagnosis, and they will have all that meaningful and positive experience in their life. But for me as a mental health service provider, it's really important that I inspire that hope in people, and that I encourage them to be hopeful that there is life out there to be lived to the best of people's abilities with the right supports. I'm also there, I suppose, to advocate for people, to work with my own team, to work with my colleagues in the Recovery College, and to keep myself educated and informed on things relating to families and how I can best support them. And I hold hope that people and their families will see beyond their diagnosis to live full and meaningful lives. And I also hold hope for my own family that I will be there to meet their needs. So that's the hope in Chime. And now I am going to pass you over to Sean.
Hi, my name is Sean Boland and I work as a systemic family therapy in the mental health services in Kilkenny. And I'm going to talk to you about identity in family recovery. And in particular, in the beginning, I just talk a little bit about my own family and recovery. And as in any families, there's ups and downs, and it can be quite easy just to kind of ignore each other. But our identity, I suppose, was that we do manage to get back together and talk about things. It might be always be great, but it just really helps. Also, though, I am aware that there's other family members or other families that actually make choices of moving out of home and away, and that's their choice. And also that I was talk about recovery that has really helped me in working with families and couples. And these families and couples, I kind of join with them and try and help them to overcome their difficulties. And while I hope that I helped a lot with them, they certainly helped a lot with me. And it was a privilege to meet with them. So now I'll go over to Sharon.
Thank you, Sean. My name is Sharon Maher. I facilitate workshops with Mental Health Engagement Recovery Ireland and a lot with Recovery College South East and the Water of Rat Network. And I would be an expert by experience, as they say. So what I'm going to talk about is the M in Chime, which is meaning. And my meaning at the moment would be as being a recovery educator. I'm able to give my knowledge from my lived experience to people in the workshops that I deliver. And everyone learns from each other all the time. It's a very positive experience because people are able to, through doing workshops, they're able to access the supports they might need, and we can start the conversations about different mental health issues. It breaks down the stigma for people. A lot of people just want to talk at the moment, so it means a lot to be able to facilitate that, in these current times. And a lot of families members, they're all looking for different meanings. All our roles have changed now. We all have different meaningful roles in the family. They keep changing from day to day at the moment. So that's really everything that I have to say about meaning. But recovery education, it means everything to me at this moment in time. So thanks very much, and I'll hand you back to Belinda.
Thank you, Sharon. My name is Belinda Kyle, and I'm a family peer educator and also a recovery facilitator with Recovery College South East. And I'm going to talk about E in Chime. And E is empowerment, and empowerment to me is having my own right to have my own life and well-being, and also supporting my loved one in recovery. As being a family member with mental health and addiction challenges in my family and being a carer, it's given me a choice in equal partnership as a family member in recovery and mental health. And also it's refocusing my strengths on how do I access information and help in the mental health services, and then also in peer support networks and support groups in the community. And empowerment is a positive aspect of Chime to me. And I like empower myself in education, empower myself in educating my family around mental health and recovery. And now, as all of the panel here today talked about Chime. Now it's your turn to put Chime into action by what makes you feel connected with your family. Where do you find the hope? How do you feel your identity? What gives you meaning? When do you feel empowered? And remember, just to ask yourself these questions every time as a family member and connect through Family Chime. And remember, be kind to yourself and happy International Families Day. Thank you, everyone. Thank you to the panel and thank you, everyone.
So thank you again to Belinda, Gina, Louise, Sean and Sharon for sharing their experience and how they use Chime. We really want the family recovery conversations to keep going beyond today, so please do keep tweeting, looking up online and connecting in with your local recovery colleges and your local fora. Please do send us a chat if you have any questions, and we are available by email. So we now move to the last part of the day. The depth and wealth of knowledge and experience coming through from all the videos today has been phenomenal. We're coming to the end of the day, and I'm going to hand you over to Michael Ryan. But before that, I would like you to share in some music and song to celebrate this day. We'd like to thank Con and Grania Murphy for sharing this with us. And once again, happy International Day of Families. It has been a pleasure to work on this conference today. And don't forget, feel free to sing along. Thank you all.
Hi folks, let us begin by saying a massive congrats to everybody involved in putting together this wonderful Families Together for Mental Health conference. We're delighted to be part of it and to have been invited to sing a song for you. My name is Con Murphy, this is my wife Grania.
Hello.
We're going to do a Benny King classic, Stand By Me. I hope you all know it. Please do sing along. We'd love if you got involved. So it goes a little bit like this. 1, 2, 3, 4.
Stand by me.
Thanks very much, folks. We hope you enjoy the rest of the conference. Thank you.
Michael, I'm going to hand you over now to Ina.
Hello again. I hope you can all hear me okay. Wow, what a wonderful day we've had. I think we can really say that our first virtual conference was a success, and what a way it was to celebrate International Family Day. And I suppose the thing I need to do now is to thank a few people for the great day we've had, and there's so many. I hope I don't leave anybody out. But thanks to all our panelists, they were really fantastic. Our keynote speakers, all our video contributors, and our partner organisations, along with us here in the HSE, Alcohol Action Ireland, Mental Health Ireland, Shine, Family Resource Centre, National Forums, and all my own team in particular, the area leads for engagement, and all the family members and service users who contributed, and of course our musicians. And I suppose for me, when I think about it, the key messages that I heard today was, that in recovery, it's a whole family business. It's a whole family approach, and we need to approach it as a family. And we learned some valuable ideas on how to do that, and tips and techniques today throughout the conference. And I suppose the other thing we learned from a service improvement point of view is, the role that family members can have in supporting recovery, in supporting other individuals in recovery, in supporting services to becoming more recovery orientated, and in supporting other family members as well. And I think that's very important. And I certainly look forward in mental health engagement, as all the team and area leads, in continuing to work with families and to achieve better outcomes for all of us. We say, in recovery that as we've heard from the many of the chairs today, of the importance of hope. So I think that we're all leaving this conference much more hopeful about family recovery. So thanks to everybody who's joined in online. The numbers have been very strong, and the social media response has been very active as well. So it just leaves me to hope that we all will meet again soon, and to wish you all well, and thank you very much.